Hello.
You alright? Lydia. Not Maisie.
Yeah, fine. Lydia's my name, yeah.
Morning, Lydia. My name's Fran.
Hi.
Have you got an issue with your meds this morning?
So basically, I'm here for a renal bladder infection. I've emailed 6 reports to confirm I have a renal bladder infection. I'm not here for anything else. I'm not here for Parkinson's. I'm not here for mental health. I'm here, I've been referred to the urology department for a renal bladder infection. What's happened up until now, I've been very, very happy with the healthcare I've received.
Yeah.
I want to be very clear that what's happened as of about 3 a.m. is now becoming extremely suspicious.
Okay.
So I'm going to tell you the facts.
Yeah, go on.
So at 3 a.m. I asked for some pain relief.
Yeah.
Up until now, I've been here 2 days. I've been given an ibuprofen.
Right.
Then a nurse, and as I say, before this, everything was fine. Then at 3 a.m. a nurse came in and she brought in a packet of medication, including eye drops, which I know I need, cephalexin, which I know I've been prescribed by the doctor, and then a big packet of a medication called psilocybin hydrochloride, which is for Parkinson's disease.
Right.
Now, I don't have a diagnosis of Parkinson's disease. It's for managing movement disorder side effects of olanzapine. I was prescribed olanzapine 3 years ago, and I'm actually allergic to olanzapine, and that's on my medical records. Olanzapine is a mental health medication. I'm not here for mental health. I'm here for a bladder urological infection, which so far I've been here now nearly 3 days, and all I've had is one single antibiotic oral tablet. So I need to know really, like, I cannot stress this enough, and I am being very professional and polite in saying this, but I'm actually feeling really concerned about what's going on. I'll be honest with you, I think there is foul play going on. I think there is a bad actor who's interfering with the system on the computer, because there is absolutely no reason why I should be being brought medication for Parkinson's when I'm here for a renal bladder infection. And just to be clear, the only medication I've been informed of, and the only medication I consent to take it, is cephalexin, methenamine hypurate, which I've discussed with the doctor, cephalexin, which I've discussed with the doctor. Both of those are for a renal bladder infection.
Yeah.
I have not consented to any other medication. I do not have a diagnosis of Parkinson's. There is no doctor that has discussed or informed me that I'm being prescribed any other medications.
Okay,
so I really need to know what's going on.
The olanzapine and the other one you took years ago, 3 years ago?
Literally more than 3 years ago, and I'm actually allergic to it, so it was
Have you got a GP here in Leeds?
Yes, my GP's York
Let
Street.
me get, I think what's happened is, they're on your GP record, and then all the medication, because we link services, I've just transferred over. Let me get a little screen so I can have a look.
I think that's the case, but literally, I just have to be really clear. They are on my record from literally 3 years ago.
It just depends on if the GP has not taken them off.
Yeah, if the GP, that's what I'm saying. I think it's probably an administrative error, but in light of the fact that
have they been putting that?
It's happened very suddenly, and it's, I'm still suffering from this infection, and I still need to take the cephalexin. And what's happening, I just want to be very clear. I was informed yesterday as well by the nurse that the medication for Parkinson's disease had already been administered to me earlier in the day, and I'd taken it.
Right.
Okay. If that were the case, and again, this is nothing against you, but if that were the case, that would be a serious crime, because I have not consented to taking procyclidine hydrochloride. I've not been informed I've been prescribed procyclidine hydrochloride, and I don't have a diagnosis of Parkinson's disease. So if you look in that packet, and some of those pills have been given to me, that would be misdiagnosis, and it would also be basically forced drugging with a drug that I don't have an illness for, and I would have to report that to the police. And again, that's nothing against you, but that's just for my own safety.
So there is one missing.
Of the procyclidine?
Of the procyclidine, yeah.
Right, well that needs to be
investigated. Take it away.
So just to be clear, I've been given a drug for Parkinson's disease yesterday without my consent, without my knowledge, without any diagnosis, and without that having been prescribed by a doctor. I've never ever taken procyclidine.
It is prescribed by a doctor.
I know it was prescribed years ago. It was. I can give you a date. It was prescribed to me in about April 2023, and I didn't take it because I didn't need it.
Okay. It has been prescribed this time because when the doctors looked, they have to prescribe what comes across from the GP. So it has actually been prescribed by a doctor.
So I understand what's happened.
But I agree. What's happened is.
So what's happened is that
the
GP, I haven't even been to a new patient registration appointment at this new GP yet. I've actually never been to this new GP yet. So that's one thing. And the second thing is they've not updated, the only medications I take is eye drops, and that's it basically, usually. And so they haven't taken it off my record, and it's obviously been automatically passed on to you, but it's become a safeguarding risk because psilocybin hydrochloride is a very, very potent medication for movement disorders, and I don't have a movement disorder.
No.
So I've taken that yesterday without my knowledge, consent, without any doctor having approved it, down due to an administrative error. You know, and that is really, really concerning for me. So I hope that the GP needs to be contacted to take those medications off my record and introduce only the cephalexin, the methenamine hypurate, the eye drops, which are for dry eye disease, and then a bladder urothelium infection, which is what I'm in.
You're right here now.
Which is what I'm in the urology department for.
Yeah. Okay, so let me look at your antibiotics and see what we've been doing about antibiotics. You said you've only had one tablet in the 3 days. When did you come down to us?
Cephalexin, which I've discussed at detail with the doctor.
Did you come overnight to us or last night?
I've been here, I stayed last night, I stayed the night before.
Okay.
I was admitted on that afternoon. So
Right,
I've been here 2 nights. The first night I was in the assessment ward, and then last night I was here.
Transferred down here, yes.
But it was Dr. Paul.
Yeah. Who will be back round this morning.
I mean, he's a retired urologist, so he used to work in patient cancer care, but he's
He's
semi-retired. But
he will be back today, this morning.
Yeah, he said that to me. He said he's going to come with me to see how I reacted to the cephalexin and to maybe arrange an ultrasound or to change the treatment. But which is all I'm expecting, consent to, have discussed with the doctor. But you must understand. I mean, imagine you're pregnant.
No, I
imagine if somebody, if you're here for a cystitis in pregnancy, and then suddenly somebody decides to prescribe you something for asthma. And then you find out that you've been given a tablet for asthma yesterday and you weren't even aware. You don't have asthma, you're trying to protect your baby, you don't know why you were given it, you haven't been informed of it, and you've never taken it. You'd be kind of like terrified, you know.
I totally agree with where you're coming from.
Yeah.
I'll look into it for you. I'll speak to Mr. Paul before he gets down here.
I'm sure it is due to an administrative error.
It's to do with the fact that everything's been dragged across from a GP.
I know.
And if you have recently changed GPs, they've probably not said that you're not taking them. But I'll be able to have a look at when those will actually last prescribed for you. Has anybody come to see you from pharmacy?
No, not yet.
So you've seen no pharmacist since you've been here?
And then discussed with the Dr. Paul, the cephalexin for the bladder infection, all good, all fine, agreed on, consented to take, all good, all fine. And then suddenly at 3 a.m, there's been, obviously, the GP's not taken off my records, medication that was prescribed years ago, and also medication that was prescribed years ago that I never took, or that I'm allergic to and had an adverse reaction to.
And I'll double check that olanzapine is actually on urology, and we've got a red band on, so there's something on there. So I'll have a look.
Yeah, there is. It's olanzapine that's on my list of allergies.
And that's it.
I think penicillin as well is because I had a very bad adverse reaction to the combination of coamoxiclav with trimethoprim. But I for whatever reason I just became aware that I was having a very bad reaction of C. diff to it, and I was in a place mentally where I was able to realise I was having that reaction. So that's why they put, I think, probably also penicillin. But then I discussed that with Dr. Paul actually, and he reminded me now because I've just woken up, so I'm a bit groggy. And he said to me that he was going to speak to the immunologist and I think the pharmacist about what was an initial antibiotic he wanted to prescribe you that contained penicillin. And then he said, we're not going to give you anything overnight, and we'll discuss it in the morning. But then I suggested, how about the cephalexin, because that's the first line treatment option as per this other doctor. So then he prescribed me the cephalexin, because that is kind of like no risk of C. diff, very safe to take, first line treatment option. But I think he still wants to discuss the other antibiotic, maybe for me to take it in combination or...
Let me go and have a look through all the notes. Let me check the antibiotics, see what has been given. Pain relief, have you had pain relief? Do you think you've had enough? Because obviously we talked about ibuprofen.
What have I had today? I think they might have just brought this over, which was 2 paracetamol.
Okay, and
I can't be sure if that was before I went to sleep or after I went to sleep. Because I fell asleep late, like 3 a.m. I'm not sure if I do need more pain relief.
Right, I'll have a look and see if there's any more pain relief to give, and I'll just double check this prescription from GP, and I will get a pharmacist to come and speak to you, because they're the best people to be able to take those drugs from the GP record.
Thank you, Fran. Yeah, thank you.
No problem.
Coffee, sugar. In the beaker, in the red beaker. Huh? Yeah, I'll go and ask them. How long have you been awake? I was trying to wake you up, or what? What? Do you need somebody to help you with breakfast? Corinne, you said Rice Krispies. Do you want some soup for lunch?
I'm just looking at the lunch menu.
Finger sausage roll, baked
Sorry, wait, what were you
potatoes,
asking me? What were you asking me?
jack and potato,
Oh, you ate? You want tea or coffee?
sandwich,
I
and
haven't had
salad.
anything today, so tea would be great, yeah. No, sorry, coffee.
Coffee, sugar.
Ice cream,
No sugar, just milk, please. Thank you.
a banana. And for evening meal, baked chicken and vegetable pie, with some green beans and carrots,
Is he eating?
apple sponge, rice,
Yeah, I
apple
believe so.
sponge with
Yes,
custard.
please, that would be lovely. I've just woken up, so I haven't had
Yeah.
anything yet.
Do you want? Are you having a coffee?
Yeah.
So you can have this. You've had paracetamol. You
Yeah.
must have had that in the middle of the night. You can't have it till later on this morning.
Oh, okay.
So, but you can have some codeine and some ibuprofen or ibuprofen, whatever you.
I'll just go for the
Ibuprofen. So we'll give you ibuprofen. On your prescription, you've also got the mini pill prescribed. Do you still take that?
Hey, love.
So I haven't been sexually active in years.
No. Do you want to take it? Because obviously people can take it for different things.
Yeah, so
That's why we
basically
get that
that's
taken
another
off.
thing that I was prescribed. That was literally before I
When you were
became
about a
pregnant,
teenager.
which was in 2021. So there's been an administrative
There's a
error.
massive error. So we'll get the mini pill taken off as well.
Thank you.
And then the eye drops. That's all that's on there now.
Yeah, I've got the eye
And
drops.
you've got
I
the
will
eye drops
take
and you can
those.
do your
Yeah.
own eye drops.
Yeah,
Right, we'll get you some
I'll bring those
ibuprofen.
back out. Thank you.
Right.
And can I just ask, is this do I do fill in this side of the menu?
Both
or
sides.
this side? Both sides.
One
okay.
side's evening, so
Oh, okay.
evening meal and then lunch.
Okay.
All right.
Okay. Thank you. Thank you.
Joyce.
You want tea or coffee? Say you don't want anything.
Cornflakes, sugar, a slice of toast, with jam or marmalade.
And a cup of tea, not too strong, sometimes strong tea. One and a half sugar, please.
Yeah.
I don't know where this goes. I haven't done anything.
No. No.
Are you watching?
Hello. Are you okay?
Morning.
Morning.
What would you like for breakfast, Lydia?
Oh, what do you have?
Cornflakes, brown flakes, Weetabix, Rice Krispies, toast, and porridge.
Could I have the porridge was great yesterday and just the same as yesterday, the toast. I don't know if it was you who was in the other ward yesterday.
No, it was
Just the porridge of the toast, yeah, would be great.
Would you like some sugar in your porridge?
Oh, I will. Yeah, that would be great. Thank you.
Tea, coffee, orange juice?
I'll go for orange juice. 'Cause I've already got a coffee here, so I'll just have orange juice. Thank you.
Are you okay with brown toast?
Yeah, that's great. That's fine.
Did you say jam or marmalade? Sorry.
John.
Please.
This will be a
Lydia,
Yeah,
I've got your ibuprofen.
thank you. I discussed it with the nurse.
Yeah.
She understands what's happened.
Yeah.
Because I've got a new GP that I've never been to, I've never seen, I haven't had an appointment with yet. They've not them, but whoever it is has
They've
has
taken
still
out
got
Your old
medications that I was
patients.
psilocybin. I know when I was prescribed that it was in about February 2023. The mini pill I was prescribed that before I became pregnant in 2021. So what's happened? It's an administrative error. That's
They haven't
happened. So the
taken out.
GP just needs to take off the
Yeah.
medications and basically review the ones I really should have, which is the eye drops, the
Yeah.
IBS medication, SIBA if I have that, because I was told I had that,
Yeah.
small intestinal bacterial overgrowth, and anything else that I've been actually diagnosed with, and I have like fibromyalgia. I have fibromyalgia, but those particular medications, I have literally not been prescribed those for over 2 years.
They will take it out. Pharmacy will come and then they will rectify it.
Mm-mm.
Yeah.
Thank you. I appreciate it. I appreciate that. It was just a bit of a shock because I'd just woken up and I don't know how I'm reacting to the cephalexin for the urine, the
Yeah.
bladder infection, and I've just woken up. I haven't even washed my face yet, and I just was in a bit of shock because I was kind of like, where is this coming from suddenly? Like you know, you're like, the last time I heard that name of that medication was literally over 2.5 years ago.
Yeah.
Now they want to prescribe it to me. I haven't spoken to the doctor about it, and I know it was due to an administrative error, but it was just quite a shock. So thank you for looking into it, and I'm glad that hopefully they can. The GP just needs to reassess based on
Yes,
recent medical records
yeah.
which medication I need.
Pharmacy can do that as well. So they will all seize the medications you have not been taking. They will just come and talk to you and confirm what the medications you are really taking.
Yeah, and they just need to check the date because this nurse said they just need to check the dates. When was I prescribed this medication? Was it in 2023? And then look at the recent diagnosis and then, or any like recent. Yeah. The eye drops. It's great that you brought me the eye drops because I need those. So
Yeah. No worries. You have 3 eye drops, isn't it? 2 eye drops and 1 eye gel.
So all I've got is one. All I've got is one eye drop actually, and then a phone that won't stop ringing because it's broken. But yeah, no, I'll find it for you.
Yeah,
find it for you.
I'll
I've
come
just
back.
got one eye drop at the
Yeah.
moment, but she might have put the rest in the. She might have put the other eye drops in the medicine cabinet.
I think she ordered it, but I'll confirm the rest of your eye drops with you if it's the one
Yeah,
you're
thank
taking.
you.
I'll come back after.
I've got,
Because-
in terms of my eyes, I've been diagnosed with meibomian gland dysfunction, blepharitis at one point, and then dry eye syndrome.
Yeah. So we've got Silene Tears eye drops.
Okay.
We've got Carbomir eye gel, and we've got your olopatadine eye drop.
Okay.
Yeah.
Yeah.
So we'll order this one and then we'll give it to you.
Okay. Thank you. Thank
No worries.
you.
Do you also take sodium ascorbate?
No. So I don't know what that's for.
It's vitamin C.
I think, yeah, that would be useful for me to take because that's to bolster the immune system. I was prescribed that by the urologist here, Dr.
Yeah.
Cozen, and that's just harmless to bolster my immune system. So yes,
Yeah,
the
I'll order
ascorbic
this one as well.
acid, I think it is, which
Yeah.
is vitamin C, I can take because that's based on the recent issues
Yeah.
from at least this year of the bladder issues, which is why I'm in urology. So yeah, that definitely would be good to take the vitamin C.
Yeah. I'll order the eye drops and vitamin C.
Thank you.
Nurse, please. Nurse, please. I'm really sorry about this phone ringing. It's basically just won't stop ringing. Please, can I have my strong pen relief? I should have had it at 8 o'clock. And I haven't got it yet.
Stop ringing.
I'll get with pain. Please, nurse. I don't know what's going on at this moment. No. I'm not seriously pain. Can't move.
I'm sorry, it's my phone. I need them to put it in a medicine cabinet because it won't stop ringing. I'm just waiting for the nurse to come over. I'm going to ask her to put it in a medicine cabinet.
And here's your strong painkiller. Sorry, the second signature. I can't take it out by myself. 2. They've increased it.
Who increased it?
Doctors.
But then it didn't say it on it. It didn't say it on which doctors.
Your medicine doctors.
Which my doctor went around yesterday.
Yeah, they've increased
He
it.
wasn't around my doctor yesterday.
Hi.
Morning. You
Hello
okay?
there. Yes, I'm okay. Are you a doctor?
No, no.
Oh, okay.
I'm just answering the buzzer.
Oh, okay. Yes, I'm here. I rang the buzzer because this phone here, I was given it by a women's group, and it's been a temporary phone. And about the day that I was admitted to urology 2 days ago, it turned off, stopped working, and then started ringing. And every now and again, it's completely switched off. I can't turn it on, but it's just making this loud sound and bothering all the other patients. So I was just wondering if you could put it in like a store cupboard. You know, like a store cupboard where nobody, a soundproof store cupboard where nobody
Can
can
I
hear
open
it.
it?
If you can, if you're technical, take out the batteries. I just don't know how to. I don't know how to do that.
Where are these for me?
I'm not very technical.
Because I
with
needed
phones.
to have a
That's weird, that's
signature.
weird, isn't it?
Yeah.
So I need to find
Try-
second signature because I can't take it out of the
Okay.
locker.
Thank you.
That one was
No, you put your locker there.
What's this? They're good earphones. This one not open.
It won't stop ringing, unfortunately. It's been happening for the last 36 hours.
So it's been like that all night.
Well, not thankfully. It stops and it starts. It just started about half an hour ago, but it could start in the middle. It's just lucky it didn't start in the middle of the night because it could do.
Yeah, have your breakfast, otherwise your tea will go cold again.
Wrap it with, just wrap it with towel.
Is there a problem with the screen?
Probably, yeah. I don't know what happened. It's a Motorola phone. I was given it as a gift, but it just 2 days ago when I was in the assessment waiting room, not even admitted yet to the urology ward, it started making these noises and stopped working, switched off. So like I've taken the SIM out and I thought that would stop the ringing, but it isn't, and it's still ringing. So I was just thinking either if you could take the batteries out or put it in like a store cupboard where
And
nobody can
the
hear it.
battery is inbuilt.
Oh, it's inbuilt.
Yeah.
So there's just no way of
Sorry.
stopping the ringing.
Yeah.
Oh my gosh.
We just have to cover it and then
Put it in a
reduce
store
the noise.
cupboard. Yeah. In like a, you know those big medicine cupboards, like pantries that you walk into, and then nobody would be able to hear it because it would be out of the way. But it will stop eventually. It just will keep going. It will keep starting on and on.
Nova, where can we keep it? Where can we keep it?
Give us a bit of peace, for God's sake.
Yes, you left it.
It stopped now.
Oh, it stopped. Great. Maybe just because it will start again. Maybe put it in like a pantry because it will probably start again, and then
Have you
this
got
lady's
the
gonna get
charger
really
here?
agitated. Sorry.
The charger. Have we got the charger?
So it was already charged. I remember when it went off, it was like half charged. But yeah, you can try plug it in, see if that helps. But it was already half charged when it stopped working.
The phone is working, but the screen, there's problem with the screen.
Oh, maybe I dropped it or somebody else dropped it. I don't know.
I'm gonna get a wrap up on it and then try to
Thank
wrap
you.
it in and see.
Just another thing I need to mention. I've been prescribed cefalexin for a renal infection by Dr. Poole yesterday, and I've had one dosage yesterday evening. But it says here that it should be for adults. It should either be 250 milligrams every 6 hours, or 500 milligrams every 12 hours. So I haven't been given it, and so I missed a dose. So I started this course of antibiotics yesterday, and I haven't been given the second dose because it's been more than 12 hours.
I'll have a word with the nurse and
Thank
she'll
you.
come and explain everything to you.
Thank you.
I have wrapped it inside this.
Okay, thank you, that's great.
Yeah. And I'm putting it here.
Yeah, that's fine. Hopefully it won't start ringing again. Are you looking for someone?
Just looking at the sockets, okay?
Oh,
Electrical.
okay.
Because needs to top it. Okay.
Yes, please. I was going to ask if I could have a shower.
Like
So-
only one or two.
If possible, two, because they're quite small and I need one for my hair. Thank you.
You're welcome.
Thank you. Are you a nurse?
No, I'm healthcare assistant.
Oh, because I was just wondering
Mhm.
if I just was wondering the main thing I'm concerned about is the cephalexin, because this is the brochure for the cephalexin which Dr. Paul prescribed me yesterday, and I should have been given one latest after 12 hours, but it's been more than 12 hours, so I need to get the next dosage of it.
I'll tell the nurse.
And like, there's no controversy with the cephalexin, because that was like on just consultation, mutually consented to, planned, arranged, discussed at detail. The only concern was that I was being told I was being prescribed medication that I was prescribed years ago due to an administrative error on my GP system. But that doesn't mean they should stop all the medication, because this is fine. Like, I've discussed this one with Dr. Paul.
All right.
Yeah,
That's
thank
fine.
you.
I will tell the nurse.
Okay, yeah, thank you.
Okay,
No. The person shouldn't brush it. The person shouldn't brush it. His hand has been paralyzed every morning for
All right.
it's done. No feeling of the finger coming back. Just leave me out, please. Thank you.
Lydia,
Hello.
you order for lunch vegetable soup and apple juice. You can't have both of them.
Oh, it's one
It
or
has
the
to be
other.
one. Yeah.
I'll go for the vegetable soup, please.
Okay.
Yeah.
Main course. You order jacket potato sandwich and the salad
I'll go for
It's just one.
just the jacket potato.
with cheese or tuna.
Tuna mayo, please. Yeah, tuna mayo. And coleslaw as the side. Like yesterday. I had that
And
yesterday. It was
coleslaw.
really
You
nice.
order pasta as well.
Was
you
that
want
for
pasta?
dinner?
Yeah, pasta and coleslaw. And for evening meal, beef bolognese or sandwich.
Beef bolognese. Yeah.
Do you want some custard with your apple sponge?
Yes, please. Yeah.
Thank you.
Thank you.
Excuse me, lady, when you're finished. My menu's still here.
I'm coming on.
My menu's still here.
Yeah, I'm coming on. I will take it.
I thought it would take longer, but it doesn't.
Yeah, I've been a few times, but
Thank you, darling.
I think it was the.
Excuse me. Oh, sorry. Just to let you know, to add it to my records, I take probiotics as well. I brought these with me.
All right.
It's literally just to protect against the overgrowth of harmful organisms.
Okay.
It's microbiomes.
That's very good. So, any concerns related to medications,
Yeah.
I would like you to speak with the nurse. I will tell her to come here so that you can.
Yeah,
Just
thank you.
everything for her.
I should need to add this to my records and then
Yeah.
about the antibiotics. Yeah, thank you. shower. And I think it's time for a shower now. I'll wait till they. Yeah, no, I think it's time for a shower. I think I want to need a shower gel. Thankfully, I've got some shampoo. I don't need to wash my hair again. I washed it yesterday. Hair wash. Fill up my water bottle. Oh no, it's full up. Okay. Okay. So let's finish the coffee and have the shower. After my wonderful, glorious 4 hours sleep. Oh, which I'm so grateful for. Oh my gosh. Do you think I used to sleep 10 hours when I was younger? 10 hours I'd sleep for, easily. Now I'm lucky if I get 4. But no complaints. Maybe tonight will be the night where I'll get 6. Maybe tonight I'll get 6 hours. And then tomorrow a full 8 hours. Wouldn't that be amazing? Wouldn't that be amazing? No complaints, sleep is sleep. Sleep is sleep. Right. It is shower time now, I think. Let's get these circulation socks off. Okay.
hair like I don't know.
Yeah, I've got some.
Hair is right for her. That's all I can have.
Yeah.
Here with that thing on the side of the bed when you go out.
Which one?
Next.
Oh yeah.
That sticks out of the bone. Oh, just a little drop, just
Yeah,
to
I'll bring it
down.
up. I'll bring it up.
And you feel, and just, yeah, please.
We'll start you out with a drip stand back now, right? Oh, that's alright. There you go. Right, I'll go ask them to sort the drip stand out. Okay?
Maureen? Maureen? Sorry to disturb you. My name's Mohammed, I'm just here from the pharmacy team. Can I ask you some quick questions? Just confirm your date of birth for me, please.
18 April.
Do you have any allergies or anything?
Resting of the heart, well, it goes back to normal.
Okay.
Yeah.
So it sounds like maybe, as far as like results from tests here go, it sounds like maybe if we potentially if the liver enzyme ALT issue is treated, that might stop the protein in urine and that might cure the issue. Because so far it seems like that's the main issue. At least since I've been here, that's been flagged.
Yeah.
But then in terms of like before, I know I had epithelial cells at level of 14 when I went to see a doctor about a few weeks ago. I had very high epithelial cells and I had pyuria, and he said that could be clinically indicative if there's pyuria of an infection, as well as the high, because epithelial cells means that the epithelial is shedding, it's trying to like fight an infection. So that's something also that I don't know if that is linked with the liver.
So it would be Mr. Paul who can best answer that, the links of those things that you have. But for now, I suggest drink plenty of water. Water helps flush out some of the infections as well, while we wait for the antibiotics that they're going to prescribe.
Absolutely, because Dr. Paul said to me that he thought, and I actually haven't heard this once before, but I know I have a problem with cysts because I have cysts on my spleen and I have cysts on my ovaries. But he said to me he thought that I maybe had cysts on my bladder. Which is the first I've heard of this. But he must have looked at a test to come to this conclusion, but he literally said, it sounds to me like you've got a cystic bladder issue. This is all caused by cysts, which would be different, I guess, to an infection.
Yeah, it would be different.
But that's it's I guess just have to wait and see what he says about. He must know about my ALT, so he might arrange further liver investigations about
I think that's why they want to do the ultrasound scan of the kidney, urethra, and the bladder, and then whatever the suggestion they will take it further to an imaging like contrast. Like MRI.
Okay, Would it be good to add in the liver to the ultrasound if that's within the blood test? If the blood test showed that the kidneys are okay, and everything, would it maybe it'd be a good idea to add in the liver to the ultrasound to scan the liver?
I don't know what criteria will they have for the scanning with regards to the doctors, because they'll be the one to request it and they will assess it if whatever scans that is appropriate. So I don't have any ideas on how they do that one, but you can suggest that one to Mr. Paul.
Yeah, when Dr. Paul comes over, which I'm sure he will eventually, then I can discuss these things with him. Yeah, that's fine. I'll just wait for him to come over then, and you stop the antibiotics, which is fine. But I've got my eye drops, and I've got you've given me the board's giving me the methenamine hyperate, which at least is doing something to sterilise the urine, because I know that is recommended to do alongside treatment. Oh, and then also the nurse said that because I was recently prescribed by urology, the department, ascorbic acid to take with the methenamine hyperate.
Yeah, we've ordered that one.
Yeah, so then at least I can take that as well. That's like, so when I start antibiotics, my immune system will have a bit of a...
Sodium ascorbic acid, they usually prescribe it with methenamine, so for absorption.
Yeah, for absorption, exactly. Exactly, yeah. Okay.
Okay, no worries.
Thank you.
Lydia,
Yeah.
can I check your weight, please?
Yeah, that's fine. My weight. Oh, 93 now. I've lost some weight since I've been here. Amazing. Yeah, I've been 94 both times they've weighed me, and now you said 93. So it's, do you know why? It's because I'm here and I don't have loads of chocolate and I don't have loads of snacks. So I'm not overeating, which is great.